Hi, it's Doug Holland, LMT, with another massage tip for massage professionals. Today I'd like to give you a tip on how I assess and stretch rotator cuff muscles. There's many ways to do this, so I'm just sharing you how I do this in hopes that you can put one of these tools in your own toolbox. Now, just as a reminder, there are four sits muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. We know those are the four. But their actions are extremely important in determining how we're going to make our assessment and which muscle is causing the problem, because we know the patients are going to be coming in. They're going to say, I got, my shoulder sore when I turn my arm this way or this way. They're going to tell you that they got some pain, and it's not a serious injury, something that they need to go to their doctor for. It's if we make an assessment, we find out it's more serious than what they think, then we need to refer them to a doctor right away. But if it's not that case, if it's just some muscle imbalances and some minor issues, we have a great way of figuring it out. So what we want to do is remember what these four actions are. So supraspinatus, as we remember, is abduction at 15 degrees. Infraspinatus is external rotation at 90 degrees. Teres minor, external rotation at 90 degrees with also extension. And then we have subscapularis, which is medial rotation across the transverse plane. All right. So the teres minor can be the difficult one because it actually has two actions, and we'll discuss that later when we get down to the table. So again, there's many ways to do this. This is just how I do this. We want to be really careful when we're stretching rotator cuff muscles because we don't want to cause injury. That's the most important point. So let's get down to the table and have some fun. All right, so I like to test the supraspinatus first. And the way we do that is we keep the arm fully lengthened just on the edge of the table right here. So you want that patient close to the edge of the table. I'm going to pin the hand against the lateral aspect of the hip here, and I'm going to use the palm of my hand to hold that hand down. Then I'm going to ask the patient to abduct their arm. So that means to push it out to the side. And as they're pushing it out into that 15 to 20 degree window, I'm looking for them to say they have discomfort or tension or stress in that shoulder. If they have serious pain in any of these exercises, I'm going to send them to the doctor to get an MRI because we don't want to cause further injury. So if it's just discomfort, we go good. So what we're going to do is bring that arm back. For the stretch, we're going to break it at the elbow. We're going to tuck the hand behind on a woman. It's going to be about where her bra strap is, a guy right underneath the scapula. Then we're going to take the palm of our hand, we're going to put it over the elbow like this, and we're going to externally rotate the shoulder by pushing the elbow down. We're going to do about 5 seconds where we feel the resistance, release, then push harder, 5 seconds, then release. And we're going to do that multiple times for about 30 seconds, and we might do that for about a minute and a half for the full stretch on that shoulder for that day. Now, how would we test to see if it's the infraspinatus? Well, the way we do that is we abduct the arm all the way out like this. Then we break the elbow here, and then we ask the patient to push their hand towards the floor at that 90-degree angle. So the arm is at 90 degrees here, and as they're pushing that arm back, if they have any pain in the shoulder, we know it's probably going to be from the infraspinatus or the teres minor. It's going to be one or the other. So how would we go about stretching that? Again, we bring it back into what we call the chicken wing stretch. But this time, I found a little trick. I like to go up, internally rotate the shoulder to get to that infraspinatus or teres minor tendons. You really get that stretch. This is a phenomenal stretch. People, even without shoulder problems, they love this particular stretch. So again, 5 seconds, release, 5 seconds, release, 5 seconds, release, 5 seconds, release. This feels really, really wonderful. Now we want to look at the subscapularis. How do we test for the subscapularis? Well, the way we do that is we bring the arm all the way around like this. Just maybe past the transverse plane, just a little bit. put my hand on top of theirs and I ask them to reach for the ceiling. So go ahead and reach for the ceiling. Push, 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 push. Anywhere between here and getting about mid-sagittal. Anywhere in here. Now you could also start the test with them in this position and then you would just push the arm back. But if they feel any kind of discomfort in that shoulder, that's where we're going to be seeing the subscapularis come in. Now we need to learn to discern the difference between the subscapularis and the pectoralis major, because remember the subscapularis attaches to the lesser tubercle of the humerus, whereas the pectoralis major attaches to the intertubercular sulcus. How I figure out the difference is one's going to demonstrate discomfort in the shoulder itself, the other is going to be more discomfort in the chest, right where it meets the shoulder. So this is where a lot of questions to the patient is going to come in. Do you feel it more in the chest or do you feel it more in the shoulder? And they can pinpoint it. They're pretty good at doing that. So how do we stretch the subscapularis? Well, this is my tip, this is one of the tricks that I learned, is I take my fist and I don't keep it flat like this. I have my thumb up and I lift the shoulder and I get underneath the scapula with my fist, and then I bring the arm back into the testing position. Once it gets to where there's resistance, then I push down. Oh, this is a fantastic stretch. Now, people with elbow issues, they're not going to like this. So you're going to have to creep your fingers up and then put your hand over the elbow, and then you push from the elbow down. But you get a deep, deep, deep stretch into that subscapularis. You're also going to be stretching the pectoralis major. So you're killing two birds basically with one stone. But again, to tell the difference between the subscapularis and the pectoralis major, it's where they feel the discomfort and the stretch. So those are the 4 muscles of the shoulders. There's basically 3 stretching exercises I do from the table itself. I hope you can use one of those in your toolbox to help your patients. But I can't stress enough that if there's serious discomfort, not just average, but they're really kind of yipping a little bit, get them to their doctor so they can get an MRI so that you don't cause any kind of injury to their shoulder. I can't believe I almost forgot this really cool tip. How do you remember which direction to move the elbow during the chicken wing exercise? Well, I taught myself this. If you internally rotate the shoulder to stretch it, we know that's infraspinatus. So the infraspinatus begins with the letter I, internal rotation begins with the letter I. And if you can remember that, the supraspinatus is completely the opposite. It's external rotation. So that should make it really easy. So if you like the tips that you see in this video, please hit like and subscribe. And just remember this, if there's no discomfort on the table, well then it's nothing more than a foo-foo massage.